Hello, I'm Dr. John Preston with Light International University from San Francisco, California. 85% of prescriptions written for antidepressant medications and anti-anxiety drugs are written in primary care setting. There's a problem with this. Increasingly, managed care companies are putting pressure on primary care doctors and nurses to do psychiatric treatment. The fact is that most primary care doctors have a caseload of 1,000 to 1,200 patients. They're seeing 30 patients a day, and they do not have very much time at all to do adequate amount of history taking, diagnostic workup, treatment, and especially follow-up with their patients. It turns out that in primary care settings, 30% of people that are given a prescription for an antidepressant medication never fill the prescription. And the reason for this almost certainly is due to one of two things. Either it's the pessimism of depression, and people walk out of the doctor's office and they think, well, this antidepressant might help some people, but it's not going to help me, and they throw it in the trash. That's the nature of depression, and this is why follow-up is so critical. The other reason is everyone in our country has heard ads on TV about the warning that comes from the Food and Drug Administration that antidepressant medications may increase suicide in children, teenagers, and young adults. And that's a scary thing for people to hear, especially when they don't explain some of the details of these particular warnings. So 30% don't even fill their prescription. 33% that actually do take the medication stop taking it within the first 30 days, which is generally before the medication starts working. In addition to primary care really pressuring their practitioners to treat psychiatric disorders, in the last 15 years, the number of medical students that are choosing psychiatry as a specialty has dropped by 50%. And again, probably two reasons for this. One is psychiatry has always been low man on the totem pole in terms of reimbursement in medical specialties. But secondly, a critical issue again is managed care. And here, many psychiatrists who in past years have done a combination of psychotherapy and medication treatment have found themselves squeezed into a corner where they're only prescribing medications rather than doing psychotherapy and medications at combination, which is almost always indicated. They are now doing 20-minute, once a month medication visits. Now this leads me to just a brief couple of comments about an issue that's been a hotly debated topic, and that is whether psychologists should be allowed to be licensed to prescribe psychiatric medications. I'd like to talk about it in a somewhat broader way. I think the whole issue is not just psychologists, but psychologists and other qualified practitioners, which of course might include nurses and nurse practitioners, for instance. If these professionals have adequate training and they can demonstrate that they know the material, that they are supervised, they complete an internship, and then they are followed for a period of time, and then licensed, why not? What's the alternative? The alternative, we're already seeing the problem, that is hundreds and hundreds of thousands of people out there are suffering needlessly. And because the number of medical students getting into psychiatry is shrinking each year, this is only going to get worse as time goes by. In the late 1980s, the Department of Defense initiated a program to train psychologists to prescribe psychiatric medications, and this was a success. They did a follow-up on the psychologists who went through rigorous training, and they followed their outcomes to make sure that the treatment they were providing was appropriate and did not result in any kind of catastrophes. And in fact, they found these people were just as successful and just as safe in terms of treatment of patients as the psychiatrists. I think there's a lot of narcissism going on here, a lot of territoriality among psychiatry and psychology, among psychiatry and maybe more broadly healing professions. I think we have a social obligation to come up with ways to try to address this problem. Having psychologists get rigorous training and get licensed to prescribe medication is one thing we can do. But I think we need to look even more broadly than that to see if there are other ways we can address these needs, because the truth is, the majority of people that are not getting adequate psychiatric treatment are people from lower socioeconomic classes and people that in other ways are disenfranchised. Thanks for listening.